Despite the drumbeat of challenges facing healthcare today, a small group of volunteers at Core Physicians, New Hampshire decided to focus on telling a different story. I'm Carrie White. I'm a member of the Sparks team. We're not filmmakers. In fact, most of us had never held a camera before this project. We're nurses and frontline staff in multi-specialty medical practices with offices across the state. 6 months ago, we were introduced to appreciative inquiry and the power of asking appreciative questions. Both in team meetings and individually, we began to talk to colleagues. We invited them to think about the extraordinary that happens every day, and found that our questions elicited vibrant stories and helped to uplift us all.
There are a lot of unsung heroes out here, and I see them right in front of me right now. They go above and beyond the call of duty. They work as a group and find innovative ways to take care of the patients and their families. And this is what we want. We want you to share your stories.
We've been on the lookout for stories that would highlight innovative medical practices and stories of people going above and beyond with our patients and in our community. Our dream is to share these stories, and that these sparks will spread like wildfire.
Anyone who deals with a strength-based system in terms of helping people, things move forward faster in those situations. And looking and working towards the family's strength, the child's strength really makes a huge difference. We really think if you're a family-focused practice, or, that the parent or the patient should set the agenda for the visit. Artis Olson, who's a academic pediatrician at Dartmouth, developed several years ago Palm Pilots so that teens thinking for physicals could fill out this questionnaire on a little computer. And it's 97 questions that covers every possible issue for teens, including alcoholism, substance abuse, sexual activity, and our teens fill those out at physicals. And there's also a Palm Pilot for parents of 5 to 11-year-olds. We want kids at a young age to sort of understand what their responsibilities as a responsible patient are. And that's part of the whole transition process, not just finding a doctor for the kid when the kid turns 19 or 20, but also helping the kid become a more responsible consumer for their own care.
My name is Susan. I work for Hampton Health, and I wanted to do a little more for my community and the hospital I work for. So I teamed together with one of my coworkers who works for a local charity and started to collect clothes, diapers, formula, whatever for children newborn to 4T. So I put a message onto the hospital intranet, and the response I got from all the employees over there was overwhelming. Every lunch hour I go over to the hospital just about and pick up whatever people can donate, carriages, food, clothes, shoes, you name it. It makes me feel good because I know I'm helping someone. Actually, I'm helping a lot of people in our area clothe and feed their children.
2 years ago, my wife was on the internet and she saw the information about this great organization called Souls for Souls. And what they do is they help people collect used shoes here in the United States, and then they ship them all over the world to places that need them. And it really is a win-win situation. People come in, we tell them about it or they hear about it, and they go back to their closets and they empty out shoes that they're never going to wear or maybe shouldn't be wearing after we've talked to them about what kind of shoes they should be in. And they bring them in, they feel good, we feel good, and then they get taken from our office to my garage where they sit there for a while. And then the other cool part is we then get Winnicott kids from the high school who want to participate in community service. 20 kids come on a Saturday morning about 8 o'clock in the morning. Mm-hmm. And they take this huge pile of shoes, and it takes 20 kids about 3 or 4 hours to do this, to give you an idea. Mm-hmm. Our goal was 1,500. It's interesting how you set a goal and it happens.
It happens, right.
Last year we collected 1,100. If we do it again next year, I hope we will. We're going to shoot for 2,000.
Absolutely.
And it's gone great. Exeter Hospital is really the hero behind this because We come up with the idea, which is the easy part, and then they actually pay for the shoes to be shipped to Florida, where this company or this nonprofit organization then ships them everywhere. So without Exeter Hospital, it wouldn't happen. So we appreciate that.
Imagine this is wildly successful, and a year down the road, these stories are showing up all over CORE. Stories that you've captured. What would be the effect? What would you imagine is happening to people as they see them?
I think it would make employees feel like the organization, CORE itself, is strongly behind them but proud of them. And they need to know this. And it's a very difficult thing for when it grows to the amount that we have grown and still growing, for the people in the trenches to
And still keep that touch.
and to
That
feel
human
like
touch
they
amongst
are
us all.
valued. This is true value.
We're always working on positive acknowledgement in our office, or suggestions of somebody who did something this week that we should recognize. And I mean, instead of just having it on an office level where the office manager's like posting it on a board or mentioning it to giving like an attaboy or whatever. In this case, we're acknowledging it to the level of showing the entire organization.
Customers, patients can pick wherever they want now to go, and they choose to come to CORE. And the stories that you guys are capturing shows us why CORE, because people go above and beyond and do special things. We make connections with our patients. That's what makes CORE unique.
We all individually are spreading it as a team together. I think that's, when they see those stories, I think they're going to feel like they want to tell more.
You don't realize on how many good stories there are actually out there and how much we touch patients' lives.